Plaque regression is really cool. Plaque regression is just the neatest thing ever because it's removing plaque. How to get plaque to leave your arteries, especially your carotid arteries and your coronary arteries. You don't want plaque there, or in your legs. You want it gone from everywhere. Or for men, if they have ED problems in their penis. So there are 5 things. There are really 7, but there are 5 easier things that you can do. I know a lot of you are very anti-statin. I'm still gonna have to discuss it here, so I get it. But when I've got a patient with bad coronary artery disease, facing either bypass graft surgery or medicine, by the way, those are the only 2 things that actually work to prevent heart attacks, by the way. I did not say stents in there, if you noticed. But there are 5 things that can cause plaque regression. Let's just start at the top. I'll go with the most natural ones first. First is niacin. I tend to use a controlled release niacin, niacin CRT from Design for Health. If you can't access it, you can email us and we'll give you the link. But niacin, 1,500 to 2,000 milligrams a day. And you're gonna have some flushing even with a controlled release one. Don't be alarmed by the flushing. No, it can, if you're just taking the cheap non-controlled release stuff off Amazon or whatever, which you can readily get right now, you may flush like crazy and it's horrifying because you think you're having a drug reaction to the niacin. That's normal. I flushed a little last night in the middle of the night because I take 2,000 milligrams a day. Also, getting your blood pressure down to below 120/80 causes plaque regression. Yes, it does. It's amazing. That's why they picked that number. I know there's a lot of other stuff out there about blood pressure problems are fake and all this kind of stuff. Trust me, you want it below 120/80 or right at it. Also, thyroid, you want your FT3, free T3, at around 3.8 to 4.2. Lots of studies showing plaque regression occurs there. People with normal thyroid levels, and they're always at the tippy top of the range, bizarrely enough, they don't have plaque, or it goes away or causes plaque regression. There are 2 statins, simvastatin and rosuvastatin, that cause really good plaque regression. I don't know why doctors use the statins they use. But those are the 2 I use and I've featured in my textbook on preventive medicine. Simvastatin and rosuvastatin at max dose cause really good plaque regression. If you give them with niacin, you get great plaque regression. The other option is ezetimibe or Zetia, 10 milligrams, really easy to use. I think it's 10 milligrams, maybe 100, but it causes plaque regression too. So niacin and ezetimibe, if you don't want to take a statin, are really good options. By far and away, the best option out there for plaque regression is plaque dissolution is pioglitazone. You can get generic pioglitazone, 15 milligrams. It is a diabetic medication, so you got to watch for hypoglycemia. It causes massive plaque regression. Again, you can go to PubMed and search all these terms and add the word plaque or add the word regression. You'll see all kinds of studies come out. Talk to your cardiologist or primary care physician about getting on some of these. Some of these you don't need anyone to help you with. You can do it on your own. And good luck with your plaque regression. If not, I'm more than willing to talk. I'm here. This is Dr. Dan Purser. Thanks.